Okay, so let's jump right in. When I say the word nurse, what's the first thing that pops into your head? Probably things like medicine, diagnoses, treatments, right? But what if I told you that nursing is actually built on its own sophisticated science? A science that's not about curing disease, but about caring for the person. And believe me, that one little distinction, well, it changes absolutely everything. And this slide just lays it out perfectly. On one hand, you've got the curative model. That's medicine. The focus is the disease. The goal? Get rid of it, eradicate it. But on the other hand, you have the curative model. That's nursing. And here, the focus isn't the disease at all, it's the person. The goal isn't just eradication, it's helping that person achieve a sense of wholeness. See, this isn't some lesser secondary role, it's a completely parallel and equally important science. So here's the game plan for today. First, we're going to really nail down that core difference between caring and curing. Then we'll meet three absolute giants in the field, Watson, Leininger, and Roach, who gave us the soul, the culture, and the character of care. And finally, the most important part, we'll see how all these big ideas actually hold up in the messy real world. All right, let's lock in this first big idea. Caring in nursing is so much more than just being nice or having a good bedside manner. It's a scientific framework, it's a humanistic art, and it's a deep ethical philosophy all rolled into one. And the word you're going to hear a lot is curative. It's not just about giving someone a pill, it's about preserving their dignity when they feel most vulnerable. It's about helping them feel whole again, even if their body isn't fully cured. And it's about using genuine human-to-human connection as a real, honest-to-goodness tool for healing. It's a huge concept, and we're going to keep coming back to it. So, first up, we have Jean Watson. Now, she's the one who looked past all the charts, the machines, and the diagnoses to explore the very soul of care. That universal, energetic, and yeah, even spiritual connection that can happen between a nurse and a patient. For Watson, this was everything. You are not your diagnosis. You're not the heart attack in room 3. She argued that a person has to be seen in their whole phenomenal field. That's your mind, your body, and your spirit, all tangled up together. You can't just treat one part without acknowledging and caring for all the others. Now, what's so fascinating here is watching her theory grow up. It started out as this list of 10 curative factors, almost like a clinical checklist. But over time, it matured into what she called the Caritas processes. And just listen to the language change. Installation of faith and hope becomes being authentically present. It moved from something you do to something you are. It's all about loving kindness and real, authentic connection. And all of this builds up to what Watson called the transpersonal caring relationship. This isn't your average professional chat. This is a moment, a caring moment, where it's not just a nurse and a patient, but two human beings connecting on a deeper level. And in that moment, something incredible happens. You create an environment where the patient's own power to heal is unlocked and amplified. Pretty amazing, right? Okay, so if Watson gave us the universal soul of care, our next theorist, Madeleine Leininger, brings us back down to earth. She looked at care through the lens of an anthropologist and argued, pretty convincingly, that you can't separate a person from their culture. Leininger's big idea is actually pretty simple, but it is so profound. One-size-fits-all healthcare is a recipe for disaster. For care to actually work, she said it has to be culturally congruent. That just means it has to fit with a patient's unique values, their beliefs, their whole way of life. If it doesn't, you're going to face mistrust, and people just won't follow the plan. It's that simple. And to make that happen, a nurse has to be a bridge between two completely different worlds. You have the etic view, that's the professional, objective, by-the-book medical perspective. But then you have the emic view, and that's the patient's reality. It's their insider's perspective shaped by their family, their community, their whole life story. A great nurse doesn't just dismiss that. They listen to it, understand it, and figure out how to make the two views work together. And Leininger didn't just point out the problem. She gave nurses a toolkit. She laid out 3 ways to act. Number 1 is preservation, where you actively support cultural practices that are helpful, like a traditional diet that's actually good for them. Number 2 is accommodation, where you negotiate. Maybe that means changing medication times to align with prayer times. And number 3, the trickiest one, is repatterning. That's where you work with the patient, respectfully, to find a new way to do something that might be harmful. So we've had the soul of care from Watson and the culture of care from Leininger. Now we turn to Sister Simone Roach, who focused on the character of care. She came along and asked a super practical, almost shockingly simple question. what is a nurse actually doing when they say they're caring? I mean, what does it look like? What are the specific observable behaviors? She wasn't after some grand cosmic theory. She wanted to know what turns the basic human capacity to care into a disciplined profession. And her answer came in the form of the famous 6 C's. These, she said, are the core attributes, the pillars that define a truly caring nurse: compassion, competence, confidence, conscience, commitment, and the 6th one, comportment, which is all about your professional presence and how you carry yourself. And the key here is that these are not just fuzzy, nice-to-have feelings. They are concrete, professional actions. Compassion isn't just feeling sorry for someone. Roach called it intelligent kindness. It's understanding their pain and then doing something about it. Competence is knowing your stuff, staying current on the research. And conscience, that's your moral compass, the little voice that tells you to stand up and advocate for your patients' rights. They're tangible, they're professional, and they're essential. Okay, so we've got these 3 beautiful, powerful theories. But here comes the reality check. How does any of this survive in the sheer chaos of a modern hospital? Let's talk about the real world. In nursing, they call this the theory-practice gap, and it is a very real thing. It's one thing to talk about transpersonal connections in a quiet classroom. It's another thing entirely to try and practice it in a packed ER on a Saturday night when you're short-staffed. So, the big question is, can these incredible ideals actually survive the pressure? Which leads us to the million-dollar question, doesn't it? Is this all just nice talk, some academic exercise? Or, when you actually put these caring theories to the test, do they work? Do they make a real, measurable difference in people's health? Is there proof? Well, the answer is a massive, resounding yes. And the proof is, honestly, it's pretty mind-blowing. Just look at this number, 30%. So, what is that? That's the reduction, the drop in hospital admissions at an aged care facility after they started using Leininger's principles of culturally safe care for their Aboriginal residents. They didn't just add a few posters to the wall. They brought in Aboriginal nurses, they incorporated traditional healing, and they kept people healthier and out of the hospital. That's theory leading to dramatic, undeniable results. And because of outcomes exactly like that one, this stuff isn't optional anymore. These theories are no longer just suggestions in a textbook. They have literally been written into the rule books for nurses all over the world. When regulatory bodies demand compassion and conscience, that's Roach. When they mandate culturally congruent care, that's Leininger. And when they require a holistic assessment of every patient, that's a direct line from Jean Watson. So you see, in the end, it's not Watson versus Leininger versus Roach. They're not competing ideas. They all fit together. Watson's spiritual depth, Leininger's cultural awareness, and Roach's professional character. As one writer put it so perfectly, they're the wonder glue that holds the entire nursing profession together. So I'll leave you with this final thought. The next time you see a nurse, what will you see? Will you see a technician, someone just carrying out medical tasks and following orders? Or will you see an artist, a practitioner of a deep and complex human science, working to promote not just health, but dignity and wholeness?